Good afternoon, everyone. Happy Sunday. Sorry, for the past 2 weeks I've been having rhinitis. Happy Sunday, everyone. Good afternoon. How are we doing? Hope our day has been good so far. You're welcome to today's episode of Becker Health Foundation's House of Becker Health Talks. I remain your humble host, Nurse Anane, and you're welcome to today's episode. Okay, so for the past Sundays, we've been having talks on malnutrition, but today there's going to be a little deviation because of what's happening in our health sector or what is going on recently. Now, recently, an outbreak happened in Ondo State, a condition called Lassa fever, which has been affecting and killing thousands, or should I say hundreds of people right now. So I just want to bring to our awareness and to our notice what Lassa fever is all about. So today's episode, I'll briefly discuss Lassa fever before we will now continue from where we stopped. But before we go into that, I would like to just brainstorm and let us review what we discussed last week. So last week we talked about malnutrition in children. So malnutrition is a situation whereby your child does not have enough nutrients, or it's either the nutrients are not enough, they are deficient, or they don't even have it at all. So malnutrition is the end case of what happens to your kids when they lack enough nutrients. So we talked about malnutrition being in 3 stages. We have overnutrition, we have undernutrition, and we have the coexistence of the two of them, both over and undernutrition. So we started with undernutrition last week, where we talked about 3 other segments under undernutrition, where we said we have the wasting, we have the stunted growth, we have the underweight. So those are the 3 branches we talked about undernutrition, and then we explained in details, and we gave examples, and we also gave the kinds of food you can give to such kind of a child to prevent undernutrition. But today, before we continue from where we stopped, we'll be going into Lassa fever. Sorry for that. We'll be going into Lassa fever. So what is actually Lassa fever? Now, there's an outbreak of Lassa fever presently in the West, though we've heard cases of it occurring now in the north, precisely Kaduna. But right now, we have a lot of cases in the west, in Ondo State to be precise, and there's been a reported case also in Ibadan University College Teaching Hospital. So we are trying to make everything come to our notice so that we all can be abreast of what is really happening. So Lassa fever, what is Lassa fever? Lassa fever is an illness caused by a virus. It is actually caused by a virus, a single-stranded ribonucleic acid virus that transmits this infection. It is an hemorrhagic fever virus. It transmits this infection from the host to the carrier, or from the carrier to the host. From the carrier to the host. So it can actually be transferred from infected rodents coming in contact with their body fluids, infected rodents. So when we talk about, we mean rats. So Lassa fever is actually a zoonotic virus. So it's actually gotten from urine or feces of these marmots, of these rats, when they come in contact with our household items, with the air we breathe in, with household utensils, and then we use such household utensils without keeping them clean. We tend to come down with Lassa fever. So Lassa fever, generally, it's actually caused by coming in contact with infected body fluids such as urine and feces of these rodents. And these rodents live normally in different homes that are not kept clean due to unkept environment and unkept utensils. So we can find these rats in different parts of the home, and these rats generally, basically, they are found in West Africa. So this coming in contact with the urine and feces of these rats helps to actually makes the carrier to have this infection. So without wasting time, I would like to go to the symptoms. The symptoms of this are, we have fever. Like I said, it's an hemorrhagic fever virus. So most of the times it causes fever, it causes malaise, which is body weakness, generalized weakness. We have sore throat. The individual would notice sore throat, severe headache, and chest pain. It's the symptoms actually come up like malaria initially, but as the times goes by, you will notice back pain, then chest pain, that's below the breastbone, below the sternum. There's always this stinging chest pain that the person will feel, and then ringing ears. There's nausea, there's vomiting, there's abdominal pain, there's diarrhea. All those are some of the symptoms that you notice in an individual. Then other symptoms, you have dry cough. Then the most important thing of bleeding in the mucous membrane, and also some parts of the body, such as the ears, the nose, the mouth. The person will start bleeding from there. And then we have organ failure, multiple organ failure, due to the fact that the virus has actually eaten deep into the cells, destroying most of the cells in the body. Then there's organ failure and shock. The person might even go into shock because there's bleeding, excessive bleeding in mucous membrane and other parts of the body. So the person might go into shock. So briefly, I would like to go into our prevention method. So what can we do to prevent us from coming down with this virus? Because now there's an outbreak, and a lot of people, you don't even know who is a carrier, you don't even know who is not a carrier, because at the early stage the person might not present with all these end stage symptoms. The symptoms I mentioned later, the dry cough, the bleeding from the mucous membrane, and the organ failure are the end stage symptoms. So someone having catarrh, or someone having a sore throat, or someone having a chest pain, you might not even know whether the person is carrying the virus. So how would you know? How would you actually know when someone is having this virus? So, and when you know, how would you prevent yourself from having it? First and foremost, I would like to say every one of us have to just be careful and be very vigilant about our personal hygiene. Yes, personal hygiene makes an important part in this aspect. You have to be personally clean. Like, you have to observe the hand washing techniques when you've used the toilet, when not in the use of the toilet. When you want to touch your food, make sure you wash your hands. Even when you're using utensils to eat, such as spoon and fork, make sure they are clean. Wash them thoroughly before you use them, because you don't know whether rodents have gotten to the place, or whether they might have been contaminated with urine or feces from these rats. So it's better we keep our utensils clean, and that is the personal hygiene, keeping the home clean. And there's also this aspect of keeping rodents out of home and food supplies. You can do that by buying or you can raise cats that can help scare away rats, or you can buy all these rat gums and rat poisons that can help to keep them away from the homes. And make sure you keep your food supplies, your grains, your cereals in a tight proof container. Sorry about that. I actually ran out of data, and apart from that, network was actually not on my side. Sorry about that. So like I said, we are on prevention methods. Like I said earlier, try to keep rodents out of homes and food supplies, such as you can raise cats at home. Like I said, cats can help to scare away mice and rats from the house. So when you keep these cats, they helps to prevent rats from getting towards the house or with food for supplies. And I also said we should keep our food supplies in airtight containers where rats can't get to, where they will not be able to penetrate. So that's what I said. And I also said we should personally, we should encourage effective personal hygiene. Because as humans, we tend to overlook a lot of things. Now you've kept your eating utensils in an exposed area, and you know you have rats in the home. Please before you use such utensils to eat, try to wash them. And if you have tin milks and everything, and you know you can't keep them in the refrigerator, try to clean on top of the lids before you open and use, because most times you might not be able to even see it. It's even possible you are not even seeing that a rat has actually passed urine on top of these tin containers, but you will not see it. You just open it and start using it. Doing that is exposing you and your family to Lassa fever. So it's always encouraged that please and please, let's all keep a personal hygiene during this period that there's an outbreak. And we should also try as much as possible to dispose our garbage far away from the home to help sustain a clean environment. It's not about only being clean in the house. How about your environments? Are they clean? Try to dispose garbage far away from where you stay, because having garbage close to the homes helps to breed in rats, and from there they get an avenue to get into the home. And like I said earlier, I said we should try as much as possible to keep rats from the home. So if you're disposing your garbage close to your house, close to your room, you're only inviting rats into your home. That is justice. Then another thing for the health workers, please and please, now that there's an outbreak, let us all be careful. Use of personal protective equipment such as your gloves, your mask when attending to infected patients is very, very, very paramount in this period. Now we are all scared of the outbreak of Lassa fever. Now, yes, it's actually in the southwest zone now. So we should all be very, very careful as health workers, my professional colleagues, the doctors, the nurses, and the lab scientists that are taking samples from animals and from human beings for tests. Please and please make sure those samples are handled by those that are actually qualified. That is, those are the laboratory should be well equipped in an environment whereby you can carry out tests easily without fear of being harmed. So please and please, let's try and take sample in our containment environment lab that are very well equipped. So, and also we should also use our basic hand hygiene processes, please. After a contact with a patient, before contact with a patient, we should know all when to wash our hands. Please, all professional health colleagues, let's just take to notice. I'm bringing this out because now there's an outbreak of Lassa fever. So let's all just be careful. The use of personal protective equipment is very, very essential and paramount. And then we should practice safe injection practices. It's not the one that you've used an injection, then you recap. Dispose injections in the right place, in your safety box, in your sharp box. Please and please let us adhere to this. So those are the little prevention I have for us. And please don't let us forget, when you see symptoms of what I mentioned earlier, you should not conclude this might not be actually be Lassa fever. But let everyone be on their toes. Practice hand hygiene, practice safe respiratory processes, such as using your handkerchief to sneeze or to cough when you're in public, to prevent spread of infection. Please and please, let's all adhere. So that will be the little information about Lassa fever I'll be having for today. Then we'll be going to our topic for today. I'm not going to take over time because I've spent much of our time on Lassa fever today, and I had to bring this to the notice because I said Becker Health Foundation is all about bringing information to us all, bringing information to our doorstep. You don't need to go out there before you get it. We are here to serve you well. So that was I had to bring the Lassa fever notice to everyone this afternoon. So back to our topic of last week. We were talking about malnutrition. Yay, malnutrition. So we've discussed malnutrition, though we've not gotten any questions so far from our viewers from last week. But we hope this week, as many that shall view this episode for today, they will have something to say next week. Because next week will be for our questions and answer on undernutrition and overnutrition. So I would like to get more knowledge of what we have learned from the previous week so far. So today I've actually recapped undernutrition. So today I'll be going to overnutrition. So what is overnutrition? Overnutrition is simple. It's just saying like overweight or obesity. That's how simple overnutrition is. Now your child is having too much of weight for his age. Now a child of 7 years old is not supposed to weigh more than 20 kilogram per se, or 18 to 20 kilogram. Let me put it that way. Like, it's a range. It's actually not a sport. It's a range. And then you notice that your 7 years old child is weighing up to 35 kilogram. You should be worried. That's obesity. That's having more than enough. You're having more than enough nutrients in your body, and having more than enough, it's actually going to cause health complications and health issues. That's why we have obesity and overweight. You will notice a little child coming down with diabetes. It's possible, yeah. I've actually seen a child with and we call it, I think it's childhood diabetes. Yeah, I've seen a child of 8 years that was diagnosed of that. The child was really obese. So most of the time we always advise mothers, like I said last week, make sure your nutrients are in right quantity. I don't want you to say because my child loves eating more of carbohydrates, then you bombard him or her with carbohydrates. My child loves eating more of protein, then you give only protein. No. Everything must be adequate and in right proportion and in right quantity. In right quantity. Right quantity. I'm emphasizing on it again. Right quantity. So today, overnutrition is just simply overweight and obesity. Is when a child is having more weight for his age and is obese. Like, how do you know a child is obese? When you calculate the BMI of the child, that's the body mass index, body mass index of a child, and then you notice it's above the age. It's not supposed to be within that range, so you say the child is obese. It's not only in children, we have obesity in adults too. So, but because we are narrowing this down to children, we're talking about raising up a child as now you take care of your growing children. So that's why we are saying obesity in children. So how do you prevent overnutrition? How do you prevent it? Like I said, prevention is better than cure, and we are always emphasizing on prevention. So how do you prevent overnutrition? Well, it's just simple. It's just make sure the food you're giving the child is in right quantity. The nutrient is in right quantity. Now you want to serve a child a balanced diet. If you want to give, this girl loves rice. I like eating rice. Oh, my baby's best food is rice. We know that. But that doesn't mean you give only rice. Make sure there's a little of protein. Make sure there's a little of vitamins. Make sure there's a little of mineral salts. Just mix it up. It doesn't have to be in large quantity. The other nutrient component doesn't have to be in large quantity. You can make the rice, which is the favorite, a large quantity. But then make sure you mix it up with other sources of food, other sources of nutrients, so that the child can have an actual adequate diet. So that is just the prevention. With doing this daily, I'm assuring you, your child won't go. And try to also weigh your child daily. I always advise all the mothers, immediately you're coming for postnatal for immunization. During my immunization talks, I advise mothers, get a weighing scale at home. Don't say, I can only come and weigh my child. Fine, when you're bringing your child for immunization, you're weighing the child. Definitely you're weighing the child. But I always advise, get a tape rule, get a weighing scale, and get a ruler, so that you will be measuring your child's height daily. You will know whether he is growing or is not growing, whether he is retarding in growth, whether he is getting overweight. You will definitely know, because every day when you check the child's weight, you write the date, and you write the age of the child, and you write the weight and the weight of that day against the date. So every day you will be able to check it, whether your child is actually increasing in weight or decreasing. It helps you to monitor the child's growth, and helps to monitor the child's nutrition level. So that is, in all my immunization talks, I always advise mothers, please get a weighing scale, get a ruler or a tape rule. It helps. The ruler for the height, you measure the height, and then a tape rule, you can use it to measure the height too. It helps. So please let us measure. Apart from giving an adequate diet, always watch the weight of your child every day, so that when he is reducing in weight, you know what to do, and when he is increasing too much, you know what to do. You will know whether to reduce the quantity of this social nutrient or to increase the quantity of this social nutrient. We also have other methods of checking overnutrition in our health centers, in our clinic. That's why I also advise that, even at that, after having a weighing scale, I don't advise that you stay at home. Please don't miss your immunization schedules, because when you come for them, we will be able to measure the body's arm circumference and the head circumference of a child to know whether the head is getting bigger, because when the head is getting bigger than the body, is known as kwashiorkor. Kwashiorkor is stepping in, and then you notice the body mass is very small. The baby is having a tiny hand. You measure the arm circumference, and then it's so small, it's getting to danger zone. So it's always advisable, please let's try as much as possible to always come from our immunization schedules, so that you can't miss it. Your child will also be checked. The nutrition level will also be checked there. Please you have health centers all around you, try to meet up with your immunization. It is always very important. So that will be all for today on overnutrition. By next week, I'll be taking in questions. So if you have any questions on overnutrition, or you notice that your child is overweight and you don't know what to do, you're confused, you can drop in your questions. I will be answering them next week. Though next week I might not be the only one to actually answer the questions. We have some other persons to join us too. But by God's grace, we will be happy to have them next week in our live video. And I'm praying that by God's grace, they are free enough to join us, because most of our partners in the foundation are actually having exams, school exams. So we are wishing them success. We're wishing them success in everything they do, but we will also pray that by next week they should be done, so they can actually join in our live video and also answer our questions. So thanks to everyone that spent our time to join us today. Though we didn't talk much about malnutrition, but we made sure to divulge information on Lassa fever that is ongoing, an hemorrhagic fever that is killing hundreds now. There's an outbreak of it. Please let us all beware and also maintain basic medical hygiene. Thanks to everyone that joined in, and for everyone that requested to join in the video. I'm sorry because I didn't want to waste my viewers data. That's why I didn't take in the video. Sorry. But next week, if you really want to join our video, we are going to take requests from everyone that wants to join. You give your own contribution, and if you have questions, you can drop them. So thanks to everyone who joined in. God bless you, and I wish you all a blessed Sunday. And if you really want to download this video, yes, I'm going to upload them on YouTube, so you can go to our YouTube channel. The link is in our bio. Yes, our Instagram bio at AHOUFBECCA at Anwofebeka. So go to our bio, you see the link, it will take you to directly to our YouTube videos. You can watch, download, and save for later use. And please don't forget to subscribe. Yes, don't forget to subscribe, because with your subscription you help us to get more audience and also helps us to reach out to more people. So thanks to everyone that joined in. God bless you and have a good evening. Thank you.